So the number of endoscopies you're going to have to undergo will be directly proportional to the therapy that you choose. If you're going to choose swallowed steroid as your therapy, beyond the diagnosis, the endoscopy is involved in the diagnosis, we really just kind of see, are you a steroid responder? So that's another endoscopy. And then we would periodically survey the patients if they're maintaining steroid as their primary treatment option. The dietary is a little bit more complicated. So we look at this as kind of short-term issues and then long-term gain. You go through a number of endoscopies with the dietary elimination process because we want to see if you respond to dietary elimination. And then, of course, if you do, we don't want you to have to be on a severe dietary elimination for the rest of your life. We reintroduce foods in order to see which are the particular triggers. We know that within any dietary elimination therapy that's offered, if you respond, that means you're responsive to those foods that were taken out. Now we introduce them and see which ones you're responding to. So that may be, in a 6-food elimination trial, that could be 8 to 10 repeat endoscopies as you reintroduce foods and then have to take them out because you respond to them or you don't respond to them. And but that being said, the long-term gain in that is hopefully you've defined a diet that is safe and healthy, and you can follow for the rest of your life without having to take a medication. So there are trade-offs that have to be done in this, and trade-offs are very individual. Children have a difficulty going on some of these diets. Young children, we can start off with elemental formulas and instead of eliminating things, we could be introducing things. But they still go through a lot of endoscopies in order to do that. So the hope would be in the future that we have non-invasive ways of investigating whether you're responding. But whatever path you take, it tends to then slow down the number of endoscopies to once every several years just to monitor the disease and make sure that there's not any signs of activity. Because the one thing that we know for sure is that we can't rely on symptoms alone to be an indicator of whether your disease is active. If you're having problems, it's simple to go ahead and look and see, is the disease active? But if you're feeling fine, we find that there's a significant number of patients that have active disease on biopsy. So we have to really kind of take that into consideration.